Botox help with grinding?
Well, Botox can help in managing the muscle stiffness because when the patient grinds or clenches their teeth, they have very hyperactive masseter muscle and there is a lot of tension in that masseter muscle. So what Botox does here, Botox injections, what they do, they make these muscles relaxed. So they kind of take the load off these muscles. It's not a one-off treatment. You'll have to repeat it every 3 to 6 months, depending on, of course, the consultation with your dentist or the specialist who does this job. But it's not going to stop you from grinding. So it's basically taking the tension away from the facial muscles and giving a little bit of relaxation. And that can help in managing the symptom, but that's not directly impacting the habit of bruxism.